At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.
Greetings and welcome to our latest Let's Talk Children's Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of the STHS Children's team, thank you for joining us. Prioritizing children's health is vital for their present and future well-being. It lays the foundation for healthy physical growth, strong mental and emotional development, and better academic performance. It's not just about avoiding illness, it's about fostering resilience and capabilities for a fulfilling life. So to help parents prioritize their children's health, STHS Children's hosts these monthly Let's Talk Children's Health webinars. By offering education on common health issues affecting kids, parents can help maintain their children's health and overall well-being.
Learning how to crawl and walk to just trying to memorize multiplication tables, math, learning how to read, and of course, in order to learn and grow, a degree of stress is important. However, when it's overwhelming and it begins to impact our daily lives as children, teens, and adults, then that's when we need to take that step back and acknowledge what's happening to us, not only emotionally, physically, but mentally. And even a small degree of stress, right, for children, it helps, right, because it's important as it produces that little extra energy in our brain to help us concentrate and perform well. Now, why are stress and anxiety increasing? Something that I have acknowledged and see more and more is children are playing less. And by that, I don't mean, let's play in our mobile devices and tablets, but they're being exposed a lot less to the outdoors. They're not getting that vitamin D. There's less interaction in having that holistic approach, acknowledging, let's go touch the grass, do some horticulture, but as well, there's also more pressure in academics. Now you see in schools where there's different categories, either you're in a standardized class, you're in a middle level class, or you're in a GT class. A child is impacted by that. Just even understanding, well, where do I go? Does this define me? So of course, with standardized testing, a child can be very intelligent, but they're just not test takers. And I can't stress that enough, where even though it does give you a score, unfortunately, many children take it as, hey, it's a label. But then again, we also have those extracurricular activities and sports that can definitely play an important role with increasing the stress and anxiety. Now, when is it too much? Too much stress definitely can have not just a profound impact on adults or teens, but as well on children. Even constant low levels of stress take a toll on children. Why? Because stress can change a child's mood, behavior, and it can cause hyperactivity, depression, and anxiety. So with children, anxiety and stress can manifest, can show in different ways. They become irritable, or maybe they're just too hyperly active because they don't know what to do with that, with that anxiety. And unfortunately, there are some external stressors that cannot go away. For example, in a family, if there's a divorce that they're going through, it's something that they have to navigate, become resilient to, or maybe there's now the learning disabilities, starting a new grade, starting a new school. So definitely something that we're currently seeing right now as we're heading on our back to school. But good thing is kids are always resilient and can always learn different ways to cope and manage their anxiety and stress. Now there's different types of anxiety as it relates to social, right? So with social is, how do they relate to interpersonal connection, to others in the community? How do they interact with some of their peers? What are they being forced to communicate? Some of them don't, they're not all very like to talk, or some like to be a little bit more shy. Intellectually, going back to the standardized testings, to different categories in school, can relate to their cognitive abilities. Emotional, that relates more into their interpersonal connections and affections. Spiritual, meaning and purpose. Creative, to their imagination. And physical, relates to their physical being in the body. Now that's something that we are seeing again less, where children are, they get home from school, they're already overly stressed, they've been in school for about 8 hours, and they go straight into bed and get an iPad. And sometimes even homework assignments now have to be done through the electronic system. But how can we take that step back and allow the child to decompress, to emotionally regulate, and go back, go get some outdoors and play, and at the end continue being a child. So some examples, Tom, of stress and anxiety for children. Some big stressors can be in a family unit where you have parents constantly fighting. Maybe they're moving from school districts, or they're moving from homes, taking a test. So I think here in the community, we know that Fridays are test days. So come Monday, the child is okay, but come Wednesday or Thursday, a child can maybe not get less hours of sleep. Their appetite can decrease. Why? Because it's Friday, it's test day. Even fighting, not having healthy communications with their siblings or their parents, or they're having, again, that difficulty of school. And another big stressor for children is their appearance, right? How are they being seen at school, and how is that affecting them? And some of the other smaller stressors that we're seeing in the community is homework. Every day children get homework. So not only are they in school for about 8 hours, but they have their homework. Maybe they have too many chores. They're expected to have different responsibilities and expectations at home. Then they start going into those teenage years. Hormones play a role, and we begin seeing changes in our body. What's happening to us? Sometimes we get sick, or sometimes we, just even being tardy to school can be additional stressors for anxiety. And now some typical anxiety, how it is shown with children and how they manifest. So for infants, we have that stranger anxiety, where it's approximately from 7 to 9 months, where the child only wants to stay with caregiver, mom or dad, and does not want to get out of their near eyesight. We have the early childhood, where we have that separation anxiety. Then we begin to have, you need to sleep alone in your room, and they start to see monsters, ghosts. I don't want to be alone in the dark. And then moving on to elementary. So with elementary, a lot of the anxiety and stress that we see is school performance, bullies, hurricane, natural disasters, what's happening. And middle childhood, some academic difficulties. We have that transition. We now take different types of exams, social concerns, and some may even experience familial problems, where they could be a death in the family or a separation between parents. And more in the adolescent school years, what we see, it's more of moral issues. What's right, what's going against my values and what's not, and our relationships. The future, what's going to happen once I graduate, where are my life goals at, and peer pressure. So peer pressure is definitely something that we do see across the full domains in elementary, middle school, and high school. But having an indicator and acknowledging what's happening in your child's life definitely can, have an impact on how that child navigates their anxiety and their stress. So now, when does it become harmful, Tom? Stress and anxiety becomes harmful when it affects the child's ability to learn, to make friends, when they shut down and they no longer have fun. They're no longer looking into going to school the following day, or they no longer want to socialize. And when it begins to impact a child's functioning, for instance, they can no longer understand their math courses, their reading courses. They want to, maybe get those accelerated reader points because they get rewarded at the end of the school year. They can't achieve that because they're just being pressured and stressed on meeting those expectations. And when we start seeing, of course, those physical symptoms, the child is either having challenges falling asleep or staying asleep. So they're constantly waking up in the middle of the night. What's happening? They're having those physical symptoms. So thinking becomes unrealistic, catastrophic, and pessimistic. And again, they can manifest with physical symptoms. They begin to have tummy aches, nausea, vomiting, or even then, if they're so stressed and anxious about achieving those high grades at school, then we have a child, a teen, turning into perfectionism. Now, what are some of the things that can be done for children with stress and anxiety? Some of the therapeutic modalities that could be taught to children is cognitive behavioral and play therapy. So this is where we connect their thoughts, their feelings, and their behaviors, identifying those automatic thoughts. For instance, a child can say, oh, I'm scared, I don't want to go to school. Then we begin to have that irritability or that fear, that anxiety begins to show. And unfortunately, then the behavior is, I no longer want to go. I just rather stay here at home or just avoid any type of social interactions. Parent and school support. I know the schools are very supportive when it comes to identifying or even learning when a child is having stress and anxiety. But having that parent as well connect before they correct and acknowledging what are the red flags in my child and how can I be there to support them and navigate these challenges. And taking a little bit more of a different approach, mind-body strategies. I can't stress enough how breathing is so important. Doing box breathing, that diaphragmatic breathing, to help emotionally regulate and help decrease that anxiety and stress. Doing mindfulness exercises, and of course allowing ourselves to take that step back, decompress, emotionally regulate, recharge, and keep going with our daily duties. And if it's something that is impacting your child and you can see that the child is constantly having that stress and anxiety, as a parent, maybe taking that step back and saying, well, what lifestyle or what routine changes can I take to assist my child? So for example, an earlier and structured bedtime. Children perform very well with structure if we keep that. Mirror neurons, I talk this a lot, where if a parent is emotionally calm, they're able to show that and demonstrate that to a child, and as well that child reflects that behavior with parents. And I do end with Tom. Children don't need to be perfect, don't need a perfect life. They need safe adults, supportive guidance, and tools to turn stress into strength.
All right, that's really great information, and we want to extend that information and knowledge. So let's talk a little bit about stress. We'll start with stress now, because that's the one that we all experience. So there is good stress and bad stress, right? So the good stress is okay, like getting ready for a presentation or to take a to take a test or something. That's kind of the good stress, where you can use it to fuel you for success, right?
Yes, it gives you that little bump, that little extra energy. But once it exceeds that and now it starts impacting, you no longer have that. It affects your cognitive abilities, where now you can't perform due to that. Then that's where we have more of a challenge.
And so the stress that can be harmful. So obviously, if it's too intense, long lasting, if it's sudden or overwhelming, it can really impact your child's ability to cope, right?
Correct. And not only their ability to cope, but to self-regulate. How do I go back to being emotionally regulated and go back to my daily duties?
And how can a parent help address that stress? When they start seeing that stress level go up a little bit, what are some techniques that a parent can use to help calm their child and get them to, to sort of be a little less stressed out?
For sure. So first of all, as a parent, not follow the child's behavior and get overly whelmed too. So allowing yourself to take that step back, acknowledge and validate your child's feelings, and providing, we can even, a coping skill, if I may demonstrate, it's the butterfly tapping technique.
Okay.
So activating both sides of the brain, the emotional and cognitive part of the brain. We use this a lot with the EMDR, and just mirroring and presenting it to the child where, take a moment, take a pause, and we help, by activating both sides of the brain, we help decrease that emotion. And then go back and reevaluate, well, what happened? What led you to have this behavior? And, just kind of digesting that. And
it's important to assess, to take a look back, as you say, to go back and say, where was I? What was I feeling? What was I thinking when I got to this point? And that way you can figure out for next time how to better address it.
Correct. I always ask, where does it feel in your body? Does it feel in your head? Does it feel in your hands? Give it a size, shape, and color, just to kind of know what the child is feeling and how they demonstrate. Because sometimes you'll hear them say, well, it was a big red circle, and okay, well, what happened? Well, I was thinking about the test. Okay, so they're able, with children, they think a lot in images, so acknowledging that and having them even draw. Where does it feel in your body? And just give me a size, shape, and color.
All right, now, when does stress become chronic stress?
It becomes chronic stress when the child is no longer eating, they're no longer sleeping, and now they have those physical symptoms, and sometimes they won't even be able to perform academically at their highest capacity.
And so here are some signs of stress in kids. So emotional outbursts or increased irritability. That's a telltale sign.
Oh, yes, definitely. With increased irritability, that's something that we see now every day, and that's a big red flag. Knowing when to take that step back. Okay, what happened? And the majority that we're seeing now, we're having that irritability when we're losing on games, or we didn't get that A that we were striving for, but okay, how can we do it next time, right? Acknowledging that behavior, and how can we challenge that behavior and take it into more of a positive thought and restructuring that.
Another symptom, trouble sleeping. So if you notice that your child isn't able to fall asleep right away or isn't able to sleep through the night, that's a sign, a red flag you should look out for.
Yes, definitely. So once you create a structured bedtime routine for your child, but your child is past those 30 minutes and they're still kind of tossing and turning, try to monitor. Is this happening 5 times a week? How many times a week is this happening? And if it is increasing, then definitely knowing what are we doing before we're putting the child into bedtime.
Another warning sign, withdrawing from others. So you see that they sort of keep to themselves. You're at a family function and they're kind of alone, not really interacting with anyone else, their cousins, things like that.
Yeah, social isolation and loneliness definitely is a big sign. It's what are we doing? What's happening when the child is shutting down? Because some of the behaviors that are most common are they're explosive behaviors, but when you have a child that goes over their window of tolerance, it doesn't necessarily mean the child will explode or get irritable. Some of them, the emotion is it's too big, so they'll just shut down and isolate. So that's a big red flag, knowing that they go into their rooms and you no longer see them throughout the day.
You also notice struggles with school, which is kind of one of the first signs that you see, especially now that the school year has begun. You're going to start to see some of those struggles with their school, with their grades.
Yeah, definitely checking in with the child. How are they doing with their learning abilities? Are they struggling academically, or is it only certain in with different subjects? So that is something that we are definitely seeing a lot.
All right, and then frequent headaches or stomach aches. So it starts to become a little bit physical, and you kind of start seeing that with your kids.
Yes, and once they start doing that, we know we might need to check, okay, are they really having a fever? How many times a week? Are they making that outcry where, oh, it's my tummy that's hurting, I'm having a headache, what's happening, kind of checking in before we check out, and well, how can we better help you and connect so that we can go back to school.
And I think that's an important thing when you're talking about those physical symptoms, to have a good relationship with a school nurse, because that's the first place they're going to go when they're in school, is to the school nurse with a tummy ache or a headache. And so having that relationship with the nurse who can tell you, hey, they came in 3 times this week with a headache, you may want to talk to them about stress or something else that may be happening, right?
Yes, checking in with them, and as well also having that school support, and even adding the counselor and the teacher, what's happening. Maybe there's someone that's bothering the kiddo, or it just happens to be when they're teaching math. Oh, my tummy hurts, right? Well, what's happening? So definitely having that multidisciplinary team be involved within the child's care, within the school system.
How did you know that I always went to the school nurse during math? How did you know that, Letty? I hate math. I love English, but math. But that's where you could see that they're struggling with the subject, and so that stress of having to figure out how to do fractions is causing them to want to retreat.
Yeah, just run away. Yeah, run away, get away from that, because the emotion is too big, that we can't handle it, and sometimes we can't verbalize it. So now we see this constant patterns of just when it's 2 p.m. and we're hitting math course, oh, my tummy begins to ache. And now we have those physical symptoms.
And one of the last symptoms that we're going to address is increased defiance. So you get a lot of no, and I don't want to, and I don't want to do this. And so how do you handle defiance and manage it for a child? What's your advice for managing when they're saying no or they're having a tantrum?
I think going back into acknowledging why they're saying no, but also as a parent following through with what are the house rules, what is expected here, and just reiterating, having that constant structure at school, and if at school and at home. But if the child just explodes and it's a no, what I teach a lot is, let's no longer do time out, because it seems like we're punishing the child for that behavior. But hey, let's do a time in. You're feeling very angry. What are you feeling right now? Okay, where's the no coming from? Give a size, shape, and color, and let's have a time in corner at home or even at schools where the child can learn and use their coping strategies.
Mm-hmm. And I think it's with defiance, it's important to sort of set expectations of what you will tolerate as behaviors, and not using the negatives, but turn it into a positive. Instead of saying, chew with your mouth, you stop chewing with your mouth open, you can say, can you please chew with your mouth closed?
Yes, and I always like to use, what if you allow yourself permission to choose which one is healthier, which one's a healthier version for you, instead of just giving you broccoli and lettuce. Well, what does your tummy say what they would rather have as a nutritious meal? So kind of restructuring that and making them take that decision.
Mm-hmm. And I think another good tip is and it's difficult for parents, is to act, not react.
Correct. And it's parenting, it's a great thing, but it's very challenging. But acknowledging, what are we feeling? And even ourselves, we can give it a size, shape, and color. Am I also feeling that big red circle? Let me emotionally regulate, because you can't pour from an empty cup. So definitely recharging, and now helping meet your child's needs.
And sometimes you just have to pick your battles, right?
Yeah, sometimes you do, but I think everybody can be met in the middle if everyone is emotionally regulated, taking that step back, some time alone for the parent as well, where you can just recollect yourselves, recharge, and then continue adhering to parental duties.
Now, here are some tips for coping with stress. So we're talking stress now. We're not getting into anxiety just yet, but just the coping with the stress. So establishing and keeping routines, as you mentioned, just bedtimes, TV times, homework times. Having a nice routine can really just help a child deal with stress.
Yes, and planning ahead of time. So at night, always next to your toothbrush, because it's something that everybody does every day, next to your toothbrush, write down at night, what are your top 3 things that you need to get done? If it's putting on the shoes, making sure that your hair is looking good, that you get that backpack and that lunchbox as a child, turning in the homework, what are your top 3 priorities, and planning that day ahead, and can definitely help decrease that stress, even as for parents too.
Finding times to talk, because I think that is one of the biggest issues that parents face. They're busy, full-time jobs. Even if you're a stay-at-home parent, you're still probably really busy with pickup times and drop-offs. But taking those moments to have a conversation with your child, and that commute home is probably one of the best moments that you get with your kid, right? That 15-20 minute commute from school to home is a great time to be forced to talk.
Yeah, and this is where quality over quantity comes in, because giving your child that undivided attention and acknowledging what happened throughout their day, and even asking and showing some interest of, how was your day about, how are you doing, how are you feeling, externally and physically. So definitely connecting before correcting.
And allowing choices, which you talked about, like, do you want broccoli or do you want red pepper or whatever it may be, like giving them some choices so that they do have some control of their life, because most of their life is dictated for them when they're kids.
Yeah, definitely that self-autonomy where they know, oh, I'm growing. Now I also have a voice. Not only are my needs being met, but I can also have a voice respectfully on what I can choose, even if it's just for meals.
And then finding the humor in daily life. Sometimes we just have to laugh, right?
Yes, so that's true. As a laughter yoga leader, the subconscious does not know how to differentiate between what's real and what's not. So you can even do some fake laughter, and then the child will follow along, and you'll have the whole family laughing. So definitely finding something. It increases your dopamine and serotonin levels as well.
And this one's a really big one that I don't think we do enough of, is playing as a family. So not letting them just get on their tablet and start playing games, but trying to find ways, board games, going outside and running around and enjoying each other's company, but playing as a family unit.
Definitely. It provides the whole family unit a way to connect differently and get to know each other, because kids are growing, parents are also growing, but so are our preferences, our changes, and getting to know what our changes are and what we prefer now is definitely an important part to help strengthen that communication and that relationship, that family bond as well.
And this one, practice deep breathing together, not just for your child, but together as a family unit. So you were talking about the butterfly breathing.
Yes.
I know that at our back to school block party, you all were teaching them how to do starfish breathing.
Yes, that's correct.
And I understand that it was very successful, and we got feedback from the community that the parents were saying that their children were teaching them how to do it later, reminding them to do it. So walk us through starfish breathing just as a refresher course.
So when you have a child and maybe they're feeling emotionally dysregulated, you can tell them, just pretend you're going to give me a high five, and then allow yourself to close your eyes, or just pay attention, gaze down, and take a slow, deep breath in through your nose. You hold for 4, and then you slowly breathe out. And then one more time, you take a slow, deep breath in through your nose, you hold, and you exhale out. And then you just kind of continue going through the momentum. Also, our tone of voice has to, very lulling, what we call, has to mirror how we want the child to respond.
All right, that is definitely one to keep in your coping strategies toolbox. Is starfish breathing. Now, how can we prevent the harmful effects of stress on our kids? Making sure that our kids feel safe, loved, and cared for. That's bottom line.
Communication. Communication is key to many things, Tom, and allowing them that they are safe to communicate, to reach out to an adult, and that they can express themselves and have their feelings validated.
Teach coping skills. So we talked about starfish breathing, but there's so many different types of coping skills that we can teach our kids, and it's like a toolbox that you're able to use the skills that fit in that moment. Not all of them are going to fit in that one moment, right? Correct.
Again, just having different options, at least 3 options, right? We don't want to overstimulate them, but okay, which one do you want to use today? Do you want to use tap in, where we'll be able to use some sensory items, breathing, or even drawing, scribbling activities where they're able to just redirect that emotional outburst into something that we're doing physically.
Help them take a break from stress. So stress, obviously school, so going and going for a picnic or going and playing in the park for a little bit. We're supposed to play as a family, so going out and doing something where they can take a little bit of a break from that stress.
Yeah, especially in the outdoors. I mean, I know that the RGV Valley weather is not the best right now, but enjoying those afternoons or even just connecting with the board game during evening times.
All right, so now let's talk anxiety. So we've gone through stress, which almost everyone experiences. Anxiety, we can all sort of experience it. So how can you distinguish between what's normal anxiety and what is problematic anxiety?
So with the problematic anxiety, children begin to also have those physical symptoms. They begin to have sweaty palms, their heartbeat begins to race a lot more, and they now feel that the next step is life-threatening. So now they become scared, and now they no longer want to attend because it becomes life-threatening to them. And when it begins to happen every day, now that's impacting their daily life, and then you'll see more constant absent days within a child.
And you see different types of anxiety. So one of the common ones that I think you see, especially in younger children as they're getting ready to go to school, is separation anxiety, right?
Yes, separation anxiety is really, really big, especially in our elementary years. And what we could do with the children is let them know, hey, I know that now schools don't use phones, but this is something that you could do. If you think of me, have them have a fidget toy with them, or just reiterate and reinforce that you'll have their support once they come back, and they can come back to you and feel safe in their zone.
And then I know that one of the tips is to sort of put notes in their lunchbox, different places where they'll be able to find it, and they can turn and just have that little touch of mom or dad, just to remind them during the day that they are loved and supported, and that you're waiting for them at home.
Yes, definitely. Not only that, but it also boosts their self-esteem. And when the child feels loved, what do we have? Serotonin and dopamine levels rise, and the child will perform better in school. So those notes are great.
Now, some of the issues that we see with anxiety are specific phobias. So there will be some phobias that come into play. Is that right?
That's correct. And some of them could be, well, maybe there's a lot of germs in school. Maybe they see a lot of children getting sick, or even with social, just acknowledging what your child is experiencing. Is it maybe once they're entering that classroom, they begin to physically shake, their jaw shakes, they become overly anxious, that they begin to also have a panic attack. Identifying what's happening in their body and mentally, so that we can provide them with that extra support and take them to the appropriate physician.
Then we have social anxiety disorder. So tell us about that.
So with social anxiety disorder time, it happens not only in the school area, but it can also happen, let's say that you're out grocery shopping, but your child begins to hyperventilate. Your child begins to say, no, I'd rather just stay in the car. There's too many people out there. I'm becoming overwhelmed. And you still take your child to H-E-B or to the mall, and you begin to see how your child is just actively, trying to find a safe place because they feel threatened with, just too many people around them.
And panic disorder, which is those panic attacks, right, that you get.
Yes.
That is when that anxiety reaches a higher level, and it really causes them to impact their breathing and their heart rate.
Yeah, now that becomes physical, and children report, I feel like I can't breathe, I feel like my heart hurts. Immediately, some of the coping tools that I tell parents that they can utilize is grab some ice, put some ice in your neck, put some ice in your hands, because they go into what we call the dive reflex, and as mammals we go into survival mode. So at that moment our temperature goes down, and so does our heart rate, and we begin to emotionally regulate. And just grounding techniques where the child begins to feel safe, implementing breathing. So panic disorders, yes, those are already over the anxiety, but they're still very common, and usually happens once the anxiety has not been addressed for a while.
All right, and now with the symptoms of anxiety, are they similar to the ones of stress, just a little bit more enhanced? Is that what it is?
Yes, correct. With anxiety, the symptoms are a little bit more because they feel threatened. With stress, it's more they feel worried. They don't know what's going to, they're going to get that A. And now with the anxiety, it's
they're
okay,
fearful.
I'm scared. What if I don't get it? Then it becomes catastrophizing, where now they begin to have negative self-thoughts and automatic negative behaviors.
So some of those symptoms of anxiety specifically, so they become restless. They kind of find it hard to relax.
Yeah, definitely going back into that window of tolerance zone that I spoke about earlier, is their panic button is off the whole day, and going back to being emotionally regulated. That's the challenging part. So definitely addressing those high symptoms of anxiety.
They anger easily. So this is not just irritability now. This is like really getting upset.
Yes, and this is where you have a child that it might seem like they're throwing a temper tantrum, but the emotion is just so big, they don't know what to do with it, that they're scared. So now they become tearful and they become angry, and what we see on the outside is not what they're probably feeling on the inside. So just keeping an eye on what's happening with the child.
They have a hard time focusing, so they really just can't concentrate on the task at hand.
Yeah, so in school, you'll see the child kind of daydreaming or wandering around, or even becoming too talkative and kind of bothering their peers because their anxiety is a little bit overwhelmed.
So what are some of the common causes of anxiety in children?
There's different factors. It could be a home environment. It could also be genetics. That's also very important to just kind of point out there. And not being emotionally regulated. Why is that constant fear? Is it growing? Why have we not addressed it? And how can we allow that child to feel safe and to address those symptoms before they turn into either an anxiety attack or a panic attack?
And I know you touched on like moving from a new school or into a new house. How would the death of a loved one possibly cause a child anxiety?
From my experience and what I've seen, Tom, it's the child will either think, oh, will that happen to me now? Am I next? Did I do something, right? So there could be some self-blame, or what's happening, because they don't fully understand as children. They don't fully understand the whole situation, but acknowledging that the grief is real and they're probably going through different stages of grief, and seeing where they're at.
And when it comes to, obviously, we've been talking younger children starting school for the first time. We talked separation anxiety. Now let's get to the teen level and that anxiety that comes with being a teenager. And I know one of the slides talked about like acne, your appearance, things like that can cause. And I know puberty can be a very difficult time for teens. So what advice do you have for parents who are getting their children are reaching those teen years? Yeah,
so first of all, see how it's affecting her, because there's hormones, there's puberty. What's happening? Is your child covering up? Do we need to take extra measures? Maybe follow up with a medical physician, dermatologist, and how can we help and explain to them that this is part of life, this is part of their growing stages, and how they can better understand that what they're going through is normal.
All right, let's talk about how anxiety shows up in the classroom, because I think this is one where teachers will be able to tell their parents, okay, I'm starting to see this in your child. So one of them is obviously attendance problems and clingy kids. So that kind of aligns with separation anxiety.
Yes, that's correct. Disruptive behaviors as well.
Yeah, disruptive behaviors. So basically cutting, like just outbursts in class, things like that, right?
Yes, having those outbursts, even bothering their classmates, or maybe seeing that squirming and just that constant fidgeting of, maybe am I going to be called next, or just turning around and, just daydreaming, not paying attention, actually.
Frequent trips to the nurse, which we talked about. So going to the nurse's office often with physical symptoms of anxiety.
Yes, my head hurts, my tummy hurts. Can I go to the restroom? Can I go to the restroom? Having too many restroom breaks or hall passes, that is definitely a red flag for anxiety.
Problems in certain subjects, me and math, for instance.
Well, that makes two of us, but definitely, maybe, they're very attentive to when it becomes, when they're talking about social studies and science, but then they withdraw or become too fidgety or nervous when it comes to math.
Because you don't want to be called on by the teacher to answer a fraction problem if you are not a fan of math like myself.
Or if you didn't do your homework.
Or if you didn't do your homework. Not turning in homework was the other one that I was going to say. So not really getting the work done that you need to. And you get a note from the teacher saying, I haven't seen Johnny's homework in the last 2 days, 3 days.
Yeah, so as parents, definitely checking in. What is our child's responsibility? Because even though they still have responsibilities at home, they have homework that they must complete and maybe turn in the following day. And how can we maybe right there and then we'll identify, hey, if they're struggling with homework, over 90%, they're probably struggling in the classroom as well. Mm-hmm. So immediately acknowledging what they're struggling with.
Mm-hmm. And then lastly, avoiding socializing or group work. So that's something that you can see that they're sort of isolating themselves.
Yes, not participating in extracurricular activities. So as a parent, if you tell me, hey, will you stay after school for the student council, for the soccer, for the art club? No, I just rather stay home. And then they kind of isolate or go into their video games, but that's all they want to do. That's a big red flag. Just kind of address what's happening. Maybe does the child not feel comfortable? Or how can we provide them with those extra communication skills to help enhance the communication and strengthen those friendships?
Mm-hmm. So what are the complications associated with untreated anxiety? So our children are experiencing this anxiety and we're not really getting them the support that they need to go through it. What are we going to see long term?
Well, in the long term, you'll see an emotionally dysregulated teen or adult, someone that will now, instead of having severe anxiety, will now be having panic attacks, dysregulated sleep, dysregulated eating patterns as well. And it can even turn into different mood disorders because we don't know what to do with everything that we're feeling. So we just try to identify something that feels comfortable to us. And lastly, I think something that's very, very important to acknowledge is, even as children, when you can't identify that what you're going through is anxiety, but you begin to pick at yourself or pick at your skin or pull your hair, eyelashes, etc., those are self-harming
behaviors.
Those are self-harming behaviors. So knowing that maybe they're not doing it with that intention, but because the anxiety is so severe, Tom, that's what the body's doing, because what the brain can't hold, then the body does.
So how do you diagnose anxiety?
Well, with anxiety, for generalized anxiety disorders, the symptoms do have to be present within a 6-month period. And as well, it's affecting their daily life functioning, that they no longer can perform well at school. They can perform well at the home. And the things that they used to enjoy, they're no longer enjoying because they're scared and they feel threatened.
Yeah, so if you see that prolonged period, it's been 2, 3, 4 months, it's kind of getting to that 6-month mark, it really needs to be addressed as soon as possible, right?
Yes, and there's different approaches. With children, like I said, you can do cognitive behavioral therapy. There's even eye movement reprocessing and desensitization for children. There's different modalities, play therapy, and just different mindfulness approaches that you could utilize before even, just having them meet that full criteria.
And in some instances, a child may need medication to deal with anxiety, right?
That's correct, especially if it comes from genetics, and we're trying many things, but it's, it stemmed from mom or it stemmed from dad. There is a solution out there. Should you exhaust all interventions and coping skills, then you move on to seeing a psychiatrist and how they can better assist your child's anxiety.
Mm-hmm. Now, some of the ways to help with childhood anxiety, that includes daily exercise. So exercise is a positive thing, not just for your physical health, but for your mental health, right?
Correct. It increases those serotonin levels and it keeps the child active. So definitely having them play outside, and it keeps them from that screen and that blue light. So
a safe, supportive environment at school and at home. So making sure that they feel safe and supported.
100%. Home is their safe place, supposed to be their safe place. So as parents, once they come in, let that child decompress, debrief, how was the day, so that they feel safe. Should something bigger happen the following days, they know that as soon as they get home, they have an adult to reach out to.
Getting plenty of sleep, because I know that adults are supposed to get 7 to 9 hours. Children are actually supposed to get more. They're supposed to get like 9 hours of sleep depending on the age group. That's a lot of sleep, but making sure that they get their sleep, because sleep is essential to good health physically and mentally.
Correct, and even for their growth spur. So that's how the brain recharges as well at night and allows them to recover from those daily activities.
And well-balanced diets, so well-balanced meals. So eating the right foods. So having those processed foods, those foods high in sugar, those will impact your mental health and your anxiety and your stress and all of that, right?
Yes, not only that, but the energy as well. You won't feel energetic to even go for, for a soccer game or just to continue those extracurricular activities, because that excessive or processed food definitely does impact how you feel and the energy that you have.
And when you're stressed or anxious, it's easy to reach for a bag of potato chips, and then you get the bag, and then you get the large bag, and you get through the whole thing. Before you know it, you've gone through the whole thing. But that's why it's finding those healthier options. So some carrot sticks or whatever it may be that can help you so that you're not having those bad foods.
Yes, definitely. And even having those prepped Ziploc bags or prepped healthier options of snacks for children where they can just go in and grab something. There's always healthier options, but yes, and that is already stressful eating, anxious eating, and definitely another level of anxiety and stress.
All right, let's break some myths. So true or false, okay? So true or false that the people can just snap out of being anxious?
False. People cannot just snap out of just being anxious. It's very real to them what they're feeling, and it's allowing them to just decompress, take that step back, and having that support. Sometimes a lot of us say, just breathe, but that's our autonomic nervous system breathing for us. But what type of breathing, right? Mirroring those steps. Well, hey, I'm here for you. I'm your safe space right now, and then just kind of guiding the way.
Another true or false, anxiety isn't treatable.
False. Anxiety is treatable. There's definitely different types of modalities and different types of interventions that can help assist and decrease anxiety.
True or false, people need medication to manage their anxiety.
Oof, you got me there.
Always, not always, right?
Not always, not always. Some of it's manageable. When it becomes unmanageable, then I think definitely it is an option that anybody can go out to.
Okay, and then last one, children and teens don't have anxiety, they're just looking for attention.
False. No, it can show up, like I mentioned earlier, like a tantrum or they're attention seeking, but in reality, it's a child seeking for safety, seeking for comfort, and not knowing what's happening in their bodies.
All right, so we've talked about all of the different things that we can do when it comes to stress and anxiety. Coping skills are really important, and so can you tell us what are some of the coping skills that you recommend for parents to look into?
So some of the coping skills, again, just like I mentioned, the star breathing, and we'll stick with our hand. Doing the 5 method, looking for 5 things you can see around the room just to help ground the child if they're having severe anxiety. 4 things they can touch, 3 things they can hear. Using your 5 senses, basically 2 things that you can taste and maybe 1 thing that you can smell. Like I can smell your cologne right now, so I'm grounded.
Okay, you're grounded for my cologne. Hopefully I'm not grounded for wearing it. But now tell me, when it comes to the coping strategies, how important is it to do them together? Like if you're a parent and you're with your child, like sharing with them to make sure that they have that support. Is it good to do them together sometimes? It
is, because as a parent, you'll find out, it's not a one size fits all. So definitely showing them which coping skills best fits them, and your child will tell you, no, that does not work. My children tell me, no, Mom, I can't meditate, but that's a different story. But definitely doing the 5 breathing, the box breathing, star breathing. There's different coping skills out there. So
And when you're talking about adults, obviously, and understanding coping strategies with adults, it's really easy to understand mindfulness, to practice gratitude, things like that. But for a child, it may be really difficult to sort of understand those concepts. So if you can sort of simplify it for them, make it easier. So I was online and I saw that there was literally like a nice little thing that says My Coping Strategies Toolkit. It was a very simple like thing that you can find online, and it's a simple toolkit that you can create. And on there they have the 5 different things. So in this case it was take a walk. So it's just something that you can pull out of your toolkit and go for a walk. There's write in a journal. There is think positive thoughts. There's use positive self-talk. And then there's take deep breaths. So these are simple things that you can even create this little actual physical toolkit for your child. And that way they can just pull that out and understand which one works for the moment they're in, right?
Correct. And aromatherapy as well. That's a great one too. Some carrying their backpacks of little roll-ons to help, lavender roll-ons, and you smell the lavender and it allows you to ground yourself.
And coping strategies are like tools in a toolbox. It's about finding the right tool or coping strategy in the moment to help you successfully manage your emotions on the spot. So just remembering that making sure you have a lot of items in your toolkit to pull the right one that works for you in that moment.
Yes, I tell children, pretend you have an empty backpack, and each coping skill you learn, put it in there. The one that works for you, just put it in there, because it will not only help you now, but it'll help you for the rest of your life.
So when should you call a healthcare provider when you're dealing with those anxiety issues that you may experience, that your child may experience?
Definitely reach out to a healthcare provider when your child is demonstrating or having self-harming thoughts, feelings, where sometimes they'll even voice out, I can't take it anymore, I would just rather not wake up, or I just rather not be here. That's an outcry. Definitely their lack of sleep. If your child has not been sleeping already for over a week and now it's impacting them academically and at home, that's a sign your child's no longer eating. You see a decrease in weight and sleep, those are red flags, and definitely reaching out to a provider just to get further assessment.
And I think addressing it early is key, because you don't want them to end up at the behavioral hospital, at STHS Behavioral, because that's when they're in crisis mode, right?
Yeah, so if you address them at an earlier time, it will help prevent them from self-harming, from going and having those negative thoughts where they would just rather not be here because the emotion is too challenging for them that they can't handle, and can be at the behavioral hospital. But yes.
And SHS Behavioral has resources available. Where can a parent call or visit if they suspect that they're dealing with the anxiety in their child? They need some more information. They need to find out about local resources. Are you able to connect them with organizations or businesses that are helping with that, with counselors, things like that?
Definitely. Just because you call the South Texas Health System Behavioral does not mean that you are looking for an inpatient stay. We will provide you with those additional resources, those community resources where you can reach out. Some of them are free, Tom, as well, and where you can get that extra help and support when needed, and especially for the age-appropriate child.
So your last piece of advice that you would give to parents who are watching, who are dealing with potential anxiety and stress in their kids, especially as we get started with this new school year, what would you want them to take away from this presentation?
Is to be a present parent and provide them with the safe and comfort so that the child can continue reaching out to you and strengthen not only that safety net, but that communication and family bond.
All right. Well, thank you so much, Letty. We
Thank
really
you, Tom.
appreciate you being with us today.
Thank you, Tom, for having me.
And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize the health of your children, and we look forward to seeing you for our next installment of this Let's Talk Children's Health webinar on Wednesday, September 17th from 5:30 to 6:30 p.m. when we will be discussing injury prevention. Like and follow the SHS Children's Facebook page for more details on our future Let's Talk Children's Health webinars. And to view all our previous Let's Talk seminars, All you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health and the health of your little ones.
At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.